I am now in Toronto, and I hope to be here for a while.
See, I knew I had to ask that question.
How are you doing?
I'm well.
All right, everyone. We are at 10:31, so we are just going to start, and people will keep joining in. So welcome, everyone. Greetings for whatever time of the day it is in your part of the world. I know we are all in different time zones. I'm Gunjan Veda. I'm Senior Advisor with the Movement for Community-Led Development, and I will be facilitating today's call with Nellie Becklenburg from the Institute of Effectiveness. Some of you have been with us through these last 8 months as we have tried to work together, think together, brainstorm together on how to adapt ourselves, our programming, our organizations to COVID-19 and everything that it has, the situations that it has created for us. But I know some of you are new. So in March, when the world began to go into lockdown, we kept hearing from movement partners and members about the challenges that they were facing, about how they had to, stop or relook at their programming. And from April, we created this platform, these monthly calls where all of us come together and we speak about, not just the challenges that we are facing, but very practical tips on how each of us in our organization are trying to adapt what has worked, how our communities are adapting. We brainstorm together in breakout groups. We co-create, we co-strategize. We've done scenario planning exercises to plan re-entry into community. We've looked at issues of access.
We are a team that works all over the world. It's the Movement for Community-Led Development. I'm the chairman.
Hi, could you mute, please? Everybody, please mute if you're not actually speaking to the whole group. Thank you.
Thank you so much.
Hello. Hi, guys.
Hi. So we've just started the call, so would request everybody who's not speaking to be on mute. So as I was saying, we started our calls in April. Since then, we've looked at a lot of issues from trust to government. We have a working group that, that looked at how communities have adapted to COVID-19. And over the past few calls,
not when I'm seeing you.
I'm sorry, we need to, can everybody who is not, can everyone else, because I am the one who's speaking right now, so can I please request everyone to please be on mute?
And Gunjan, you can also mute everyone, and then we'll just unmute ourselves when we want to talk.
Right, mute all. Thank you so much. Okay, perfect. Thank you. Sorry about this, but we just want to go through this rapidly. So like I said, in the last few calls, we've heard from our partners from Nigeria, from DRC, from Mexico. We've heard from community leaders from Guatemala and others, all talking about this whole issue of vaccines. How a lot of people, the myths and the misconceptions that have been going around about it, how a lot of people are not convinced that this is a real problem in some countries. In some countries, there is reluctance to take it because, some people think it's a Western thing. We have also heard about access issues that we are facing. Who will get it first? We keep hearing about North America, Europe, countries, they're pre-ordering all these vaccines even before they're ready. So who will get access at what time, how? Within countries, what are the rollout strategies going to be? And then we ourselves have talked about the safety, security concerns that we have, right? Is it safe? How do we know the long-term effects of this? So all of those issues, we are going to, over the next few calls, focus on vaccine, the COVID-19 vaccine. Today's call is really going to be this conversation around a high-level conversation around what is the status. So we're going to get some information, fill in our knowledge and information gaps with the people who are perhaps the best informed about this, the WHO team. We are going to, we're going to talk about issues of what is the structure of vaccine decision-making? What kind of access plans are there? How can civil society organizations engage with it? What are safety viability issues? So it's going to be a more global high-level discussion. In our next call, which is on the 9th of December, we are going to look at implementation at the country level. So we are going to begin to talk about things like, what are the rollout plans looking like? How can civil society organizations be a part of it to include equitable access to this, to the vaccine for everyone? And we'll have the African Union joining us for that call. For those of you who've been with us through this journey, you know that we normally always have breakout groups on our calls, and that's one of the most exciting parts because all of us get to co-create. For today's call, unfortunately, we will not be able to do a breakout group because our agenda today is really to ask all the questions that have been troubling us and to raise the concerns that we've been hearing at the ground level with our communities and others. So the movement has been this kind of a bridge wherein we want to make sure that communities and organizations like us have access to the right information on the vaccine preparedness, rollout, infrastructure, and everything. But at the same time, we want to make sure that decision makers and policy makers are aware of people's concerns, people's voices are actually at the table, and decisions which are taken around the rollout take those into account. And so these calls really for us are a way to bridge that. You see the agenda on the slide. So we're going to begin with a very quick introduction to MCLD because some of you are new today. Then we are going to hear from the WHO about the vaccine development, preparedness, distribution, and essentially CSO engagement piece. We're going to get into a discussion around issues of safety and preparedness and viability. Then we're going to have panelists from Save the Children and Oxfam join us, and along with the WHO team, and we're going to look at issues of access, about how we as civil society organizations can work with governments and multilaterals on rollouts and vaccine acceptability plans. And finally, we're going to go into the next steps. Through all of this, the chat feature here is your best friend. So please introduce yourselves on chat if you haven't done so already. It's not just nice to know who all are in the room, but we've seen how these chat conversations have led to coalitions and partnerships. So you know who else is in the room from your country or the place you are working in, and that's always nice. As the presentation and the discussion goes along, any questions that you have, please put them in the chat. We will be monitoring them and ensuring that your voices are heard in the call. Nelly and I are facilitating the discussion, but really it's going to be your questions, and the panel wants to, and I know we've heard from WHO that they really want to hear what's happening on the ground as well. So use the raise hand button if you would like to speak again, but please stay muted unless until the mic is passed on to you so that we can ensure that it is smooth. So without further ado, I will pass on the mic to John Coonroth, Executive Vice President of the Hunger Project and co-founder of the Movement for Community-Led Development, to tell us a little bit about what this movement is. Thank you. John, you're muted. Sorry.
Oh, that's right, because you muted everyone. Thank you. Okay, so the Movement for Community-Led Development was created and launched along with the Sustainable Development Goals in 2015 because we recognized, many of us in civil society, that at least 12 of the SDGs could only be solved through an integrated strategy at the community level, and that communities needed to be strengthened, that there had to be a shift in power and resources into the communities. And we set 5 goals. 1, ensure voice and agency for women, youth, and marginalized groups in the local decision making. That there be adequate community finance, at least 20% of public resources needed to be in the hands of local communities. There needed to be systems of social accountability and people's participation in local governance. Hopefully that would lead to the quality public services that would be required to hit the SDGs. And it's really only at the community level that resilience can be established. So we currently have 70 international civil society groups that are global members of the movement. And then we have national chapters in more than a dozen countries who work in Latin America and West, Southern and Eastern Africa, and in Europe. We also partner with a network of civil society groups in South Asia to also advance these goals. We have kind of a two-pronged strategy. This is our theory of change. We create advocacy partnerships that engage with governments at the national level to promote decentralization, and facilitation partnerships to really work collectively to mobilize healthy, productive, resilient, self-reliant communities. If all of that comes together, real progress can occur on the SDGs. So that's it in a nutshell, and back to you, Gunjan.
Thank you, John. Actually, Nellie, I'm going to pass this on to you now so that we can begin the first part of our call.
Thank you very much, Gunjan, and thank you all for being here. We're really excited about today's discussion, which is one that will be, I'm sure, preoccupying all of us increasingly over the months to come. Without further delay, we're going to hear next from 3 colleagues from the World Health Organization who have joined us today, as Gunjan said, to speak to us about the status of the vaccine, some of the issues around distribution, safety, viability, but also importantly on how they're working to engage communities and civil societies and civil society, and some of the tools and structures that have been established and are continuing to grow to ensure that as vaccines come online, that there is uptake of them and people actually use them. So we're going to hear from them for a presentation for 15 minutes. And then, as Gunjan said, we will open it up for discussion for about 20 minutes, where we'll focus primarily on issues around safety, access. What do we need to know to be advocates for and to communicate with our partners about the vaccine in advance of it? We're going to return later to a deeper conversation on questions of access and advocacy. So as they're presenting, please feel free to put any questions or comments into the chat box on the side, and we will make sure that we have space for as many of them as possible. So with that, I will just introduce our panelists. We have Lisa Menning. She is the current team lead for the Demand and Behavioral Sciences in the Department of Immunization, Vaccines, and Biologicals, IBB. She manages their work focusing on equipping programs and partners with evidence-informed guidance and technical support to promote acceptance and uptake for the vaccination. We have Brian Tisdall, who leads on communities and civil society in the Access to COVID-19 Tools Accelerator Hub, which is also called ACT-A within the WHO. And he has previously worked on emergency programs for the WHO, as well as partnerships and polio transition program. And finally, there's also Andy Seale, who's an advisor for the WHO with the Department of Global HIV, Hepatitis, and STI programs, also focuses on community and civil society engagement, specifically through the Global Action Plan on Healthy Lives and Well-Being for All task force, I believe. So with that, over to you all, who I think will be sharing your screens.
Yep. Thank you very much, Nellie, and thanks also on behalf of Lisa and Andy to in WHO to Gunjan and John. I'm just going to share my screen here. So indeed, thanks for the opportunity to speak to the community colleagues and friends. And thanks also on behalf of the 3 of us for showing photographs of, or at least in my case, a much younger, slimmer version of me. So folks, we're going to move fairly quickly through the slides. Lisa and I are going to make the presentation. So apologies in advance for that. But as Gunjan said, what we're really interested to hear is to get, your viewpoints and feedback from you on the, the realities of working at the community level in the COVID-19 space. the first slide I put up here is really just to show the context that 46 million people have been infected and 1.2 million people have died. In the Northern Hemisphere, as those of you who are living here know, we're going into the second wave with heavy lockdowns throughout many countries. And yet, as Gunjan alluded to, we do have a sense that there's COVID-19 fatigue. You know, governments and people in particular are getting used to hearing on the news the number of COVID deaths every evening. They're getting visibly tired of lockdowns, and then we hear this kind of more and more an increased risk of vaccine nationalism, where the upper income countries are making direct deals with vaccines, and I guess that's something that we could have a chat about later. So what is the ACT Accelerator? To give it its full title, it's the Access to COVID-19 Tools Accelerator, and it's the only global solution we have, folks, which aims to bring a premature end to the pandemic, and we're doing that primarily by accelerating the development of new diagnostics, new treatments and vaccines, and also, more importantly, to achieve the equitable access so that we leave no one behind, particularly the low-income countries in the process. It's a major global initiative. It's probably one of the global initiatives that's least known, but it was established as recently as April, by the UN Secretary General, by several heads of state, Macron, von der Leyen, Merkel, etc., heads of all of the UN agencies, academia, industry, civil society is very heavily involved, and some foundations. So I thought I'd just pause a little bit and tell you, what is the structure? And basically, what we're doing here in a very kind of, it's not a permanent structure, but we are in many ways reshaping the international global health architecture by bringing together all of the organizations that you see on the screen here, working according to three pillars. So we've got the vaccines pillar with Gavi and CEPI in the lead. We've got the therapeutics pillar with UnitAid and the Wellcome Foundation. And we've got the diagnostics pillar with the Global Fund and FIND. And we've got across all of that something called the Health Systems Connector, where the World Bank and the Global Fund are in the lead with support from WHO. And then just as importantly, WHO are pushing ahead and have developed an access and allocation framework to make sure that there is equitable access throughout the globe. It's not just the rich countries that are getting access to these new tools. CSOs are heavily engaged in all of these pillars and in the Health Systems Connector. And again, I think that's possibly an issue, folks, that we could discuss perhaps during the second panel. Just a word about the achievements to date. We've only been going 4 or 5 months, but in relation to the diagnostics piece, already new rapid tests have been developed and approved. This is it's a collaboration thanks to FIND, to the Global Fund, to UnitAid, to the Gates Foundation, CHAI, and WHO. We have 120 million tests that are available to be rolled out to low-income countries, rapid diagnostic tests over the next 6 months. $3 to $5, you see the price there. That's at least a quarter the price of the PCR tests that are on the market. So we're quite excited about that. Likewise, in terms of the therapeutics, we've got therapeutic drugs ready to be rolled out, 3 million doses of dexamethasone, and some excitement around monoclonal antibodies that are in development, but which will probably be less important in the short to medium term, just because of pressures on supply. The COVAX facility, of which Lisa is an expert on, and you see here, 186 countries have signed up to join this facility, almost 90% of the world's population. And there's a very dynamic portfolio of vaccines within the facility that's being developed. And again, if we've got questions, and Lisa can speak to that a little bit later. And then underpinning all of that, the whole equitable access piece, and it pretty much does what it says in the title, you know, ensure global equitable access. I wanted to just pause a little bit to tell you how it's going to work in terms of the accelerator. I mean, the basic idea is that we want to ensure that it's not just some countries get all of the supply of these new tools. For this to work, ladies and gentlemen, all countries need to get some of the supply. So what we'll be doing in the initial phase is targeting, of course, frontline workers, health and social care workers, so 3% of the population in every country. And we'll move on quickly then to provide access to those vulnerable groups within society in your countries. And this will vary from country to country, but it's obviously targeting elderly populations, cohorts with comorbidities, etc. And then at a later stage, we'll roll on, you know, when supply is in place to provide the tools to the rest of the population. Very importantly, there'll be a buffer set aside for humanitarian contexts. So for contexts where populations may be, for example, stateless, or contexts, for example, in refugee camps where they may not normally have access to health services from the host government. I'm going to skip through this. The basic message on this slide, folks, is that the low-income countries are the ones that are at highest risk in terms of accessing all these wonderful new tools that are coming on stream. A word about the budget, because it's massive. The total budget to provide these tools to the world is $38 billion. Now that in and of itself sounds like an awful lot of money, but if you consider that the governments have invested just in the richer world $10 trillion already, trying to keep their economies going, you'll see that this represents, you know, less than 1% of the money that's being spent. In terms of where we are with the funding, we've got an immediate funding gap of 4.5 billion and a gap going forward into next year of 23 billion. So we've raised a lot of money, folks, but we're really thinking we need to shift the paradigm in terms of how we're outreaching to member states and to the private sector, because they also have both an interest to get economies going again, but also, we would argue, a responsibility to contribute to try and end the pandemic as quickly as possible. And with that, I hand over to my colleague Lisa. Lisa, over to you.
Thank you very much, Brian. And thanks also to Gunjan and John and also Nellie for the opportunity to you know, establish this dialogue and make these connections and share this information and hear from you. So I'm just briefly going to talk to the plans that are in place to support countries to achieve high acceptance and uptake of these vaccines. So, and just to kind of preface this, to give you an overview of the many contextual factors that are being taken into consideration as we're doing this planning. And this is really key to how we're working and who we're working with, and how we're going to be supporting countries. So, and also just before I dive into this, to also say that the work that I'm going to describe is situated within the Act A vaccines pillar, and there's a dedicated work stream there called Country Readiness and Delivery. And within that, there's a dedicated demand work stream. So a lot of what I'm describing here is the product of a cross-partner effort that involves not only WHO, but UNICEF, IFRC, Gavi, and many other partners at a global but also regional level, at least in these early stages, in thinking about what are the tools and guidance and approaches that are going to be necessary to help countries to achieve high uptake. So here on the slide are this range of initial considerations that we know are going to be absolutely critical to driving uptake of these vaccines. So firstly, just thinking about the expectations in this situation, there's a lot of interest in the vaccines and hope that they will really be quite pivotal in being able to slow down and address the pandemic so that we can get back to life in a way as it was. And so with those expectations, there's high visibility of the vaccines that are in development. There are multiple vaccines in the pipeline. There's over 200 that are in various stages of research and development. And each of these vaccines have different characteristics, different safety profiles. They're built on different technological platforms. They will be available at different points in time. So there's a huge amount of uncertainty and complexity in the science that we're also working to help communicate, to help communities and the public to understand what are the vaccines that are at the forefront and what are their characteristics and what will it mean for enabling programs to put in place the plans to roll them out effectively. So also in this mix, there are the accelerated development timelines and associated questions around how that's possible and whether that still assures vaccine safety. When it comes to access, there are various questions around equity and allocation and the fairness of that within and between countries. We know we're up against the challenge of reaching new target populations, adults and health workers, which are groups that many immunization programs around the world have almost never targeted in their strategies for immunization or others. And we're also thinking about what it means for potential AEFIs. We're in the next year, 2 years, we are going to be facing the fastest and largest scale vaccine rollout project ever attempted on this entire planet. So what that means is that it's given just the number of vaccines that are going to be used, it's almost inevitable that there will be certain kinds of safety events. And so we need to be really clear about why they're taking place and what they're due to, and particularly in targeting older population groups, there may be added risk there. So differentiating those events from what's vaccine related or not will also be absolutely critical. And lastly, of course, just the information environment, where we know we have fertile ground for rumors and misinformation. But I also think that the digital technologies that are available to us right now can also be an opportunity for enabling us to share the right information and stay connected. So these are some of the considerations that we're taking into account to design our strategies and to just work with the necessary partners in this initiative. So also at the back of our minds is the latest evidence on what drives vaccination uptake. So traditionally, many people have thought that you can tell people that vaccines are safe and effective and important, and they'll say, yeah, sure, I'll accept that. I'll take my child to get vaccinated. But actually, we know that that is necessary, of course. People need to have that knowledge and the related confidence in the vaccines, but it's actually not sufficient to drive vaccination uptake and the vaccination behaviours that we know we need to see in relation to COVID vaccines or any other vaccine, in fact. So what this means is that when we're working with countries and partners and communities and health systems and services to be supporting them to achieve high uptake of these vaccines, we need to be acting on a wide range of strategies. And so this includes not only what people think and feel, that the confidence they have in vaccines, their attitudes, their knowledge, certain beliefs and values, but we also need to be working on the social influences. And here's where what we're doing at a community level and the community structures and actors that we're engaging with are absolutely essential here. And these factors normally shape motivations and intentions and people's willingness. And then lastly, most importantly, in fact, are the practical issues. So this is just the ease and convenience. So having systems and services set up so that they're responsive to the communities that they're based in, that they should be serving, and that they are of adequate quality, meaning that the service quality is that represents a range of elements, the ease, the convenience, the affordability, the availability, just the experience that someone has when they're at that health center and they come in and they have some questions and concerns and they'd like to just have those answered in a respectful way. So what this means is that these behaviors are ultimately driven at a community level through the interaction between systems and services and those community groups. And the systems and services and programs need to be listening to the needs of those communities and using that to drive their strategies. And that's how we achieve high uptake. So lastly, just to give you a quick overview of the different work streams that are operating at a global level that's putting all of these plans and guidance in place to be able to support all of the various groups that we want to be working with to ensure that they're equipped and able to create this supportive environment and context at a local level that drives vaccination up. So what we're trying to do is work through a range of areas. So this is not just about acceptance and uptake and communications and advocacy and community engagement. It's also about, having enough data, all of the feedback loops and listening from a local community level that informs our strategies, and also just ensuring that we have the supply chain logistics systems set up to roll out these vaccines as well. So we have a range of these efforts that are coordinated and working together to bring all of this planning together in a way that makes sense. So I'll leave it there, but be happy to take any other questions or comments from here as well. Thank you very much. Oh, I have just a quick summary slide, but I think this just recaps on most of the points that I've already made, indicating that we do have a new context, the pandemic, new vaccines. Programs have a lot of experience in reaching children and adolescents, for example, with HPV, but we need to set up these new platforms to deliver at large scale vaccines to health workers and to adults. We're working against a range of challenges, and it really is about how we engage communities in new ways and involve them in service design and service delivery and other informational strategies. All of these things need to come together because there's no single solution that drives vaccination uptake. We need to be working across a range of different areas that can together support people to understand and appreciate the importance of vaccination and make it really easy for them to get that access. So
Thanks,
that's
Lisa.
it. Thank you very much.
Thank you, Lisa and Brian. That was a huge amount of information and incredibly informative. And I will say that I got a private message while you were talking saying, this is so cool. So thank you for sharing all of this with all of us. We were actually going to have an epidemiologist join us as well to help translate some of, what's happening at this high level and what does that mean in terms of, viability and safety of the vaccine and what do we need to know. Unfortunately, she couldn't join us at the last minute, but I'm going to abuse my power as the moderator and just ask you a first question on that vein. You both mentioned that, there's fatigue, there's misinformation, and there's all of these different channels and routes to ensure that there's uptake. What would you tell us to share with partners and communities at a really sort of essential level? What do we need to know and what do they need to know about the safety and viability of the vaccines that are coming out right now? Are they safe? Should we take them? Are they gonna be something that can be stored at our local clinic?
Yeah, thanks so much, Nellie, for this question that's really so central to the decisions people are going to be making as they weigh up the safety and the benefits of accepting these vaccines. So we know right now that, as Brian outlined, there's just been an unprecedented amount of investment and global collaboration that's come together to accelerate the development of these vaccines. So many of these processes have happened in parallel, and that's enabled the timelines to be condensed. So it actually doesn't mean that there's been any shortcuts taken on the vaccine research and development process. And more than ever, given what's at stake for confidence in vaccines generally, this is not just about even COVID vaccines, it's about the entire, shall I say, enterprise of using vaccines against all sorts of deadly and dangerous preventable diseases. We don't want to risk that. And so regulators and authorities are being extremely cautious in making sure they have adequate data before moving ahead with the vaccine rollouts. So I do think that the process is as rigorous as ever. That will help us to ensure that confidence in the safety of these vaccines when they are rolled out. That said, we also know that vaccines do occasionally cause very rare adverse events. And I think it's also important for us, for the interest of building trust and being open and transparent, that vaccines very rarely do cause serious adverse events. But the frequency of those, sometimes for different vaccines, 1 in a million doses, means that it's so rare that it actually is outweighed by all of the benefits of using the vaccine. So at this stage, I can say that, we are really confident that the eventual vaccines will have been through the necessary level of rigor in the testing and process to be reassured that what we're being offered, will be safe. I think that there will also be strict safety surveillance processes also put in place so that we're closely monitoring them as they're also being rolled out to catch anything that could occur.
Yeah, Nelly, if I could just jump in very briefly to add to
Yes, please.
Lisa's eloquent explanation about vaccines. We also need to remember that there are some of the horses in the race. Before we have the vaccine that will be available and safe and in the right quantities to vaccinate the world's population, as I like to say, if you're going to fight your enemy, you need to know who your enemy is. So we put a shout out for diagnostics. We need to, develop those diagnostic kits and get them supplied. And then when the vaccines arrive in country, of course, and you guys know this better than anybody, we need a functioning health system in place to be able to store the vaccines, to have the health workers to immunize, et cetera, et cetera. Thanks.
Thanks very much. And I think there'll be a lot of questions that are coming in, I'm seeing on the chat box, that are about, how do we deal with people's mistrust, and what kinds of mechanisms are we really using, or specific examples of mechanisms that can be used to share information. And I think we'll also have time to come back to that in the next section on advocacy and access. But one question I wanted to highlight from the chat box, coming from Ann Hendricks Jenkins, and she asks, as you've leveraged the deep learning from child vaccination efforts, how might we leverage this effort to offer additional and sustainable benefits post-COVID? How might this experience transform the vaccine world generally?
I think that's an excellent question. And I think a lot of what we're doing right now, there's a layer of everything we're doing, which is thinking about how does what we do with this intensive, concentrated and highly resourced and highly visible effort right now to roll out these vaccines, how do we ensure that what we're doing is contributing to stronger systems and stronger primary healthcare and stronger connections to community for vaccinations and for health and for health behaviours? So I think what we're really doing is thinking about the sustainability of all of this work. And so in the next year or two, there will be this intensive effort. And what we're really trying to do is make sure that we really capitalize on all of that to strengthen ultimately the dialogue that happens between communities and services. Because even, for example, thinking about misinformation and this idea of building resilience at a community level, we build that resilience by listening to communities, understanding their needs and perspectives, and then designing these systems and services to be responsive and ensuring that we're building around that structures that will hold that in good stead in future, so that, for example, there is a serious adverse event due to a vaccine, but at the end of the day, people know that they trust their health worker. They know that they trust their authorities. They trust, they know that vaccines are still a really important life-saving intervention. And so all of these things, what we're trying to do is ensure that all of these different layers of activities are grounded by this focus in the sustainability and thinking about future preparedness for disease outbreaks. And that might be just a measles outbreak, and could be a yellow fever outbreak in certain settings, or it is about the next flu pandemic or anything else that could surprise us like COVID has. So I think that at the heart of what we're doing is really thinking about communities and community resilience and the sustainability of this huge effort over the next year or two, so that it really does endure and last for us much longer into the future. Thank you.
Nellie, perhaps I can briefly build on Lisa's intervention. Thanks again to Lisa and Brian for presenting. I chose to stay quiet in the presentation because I don't have the up-to-date vaccine and commodities expertise that the two of them have. But I think Lisa's last point is critical. It's great that the ACT Accelerator is really focused on the innovations and the commodities that are coming out for diagnostics, therapeutics and vaccines. But beyond that, what Lisa was talking about, we've got this universe of community and health systems that go beyond the COVID situation that we know are struggling. And we've known in lots of disease areas that there are no magic silver bullets. So there is no one medication or one vaccine typically that's going to get us to that point of really having either ended an epidemic or really kind of like built a sustainable system. And I think the critical point here is we've got to get that community engagement piece. This is dynamic. Our world has changed, but we have to look at the broader and unfinished business areas of health as well. All of this is connected. So all of the parts of the COVID response that are beyond getting these commodities out as quickly as possibly and as equitably and as possibly, so that we're reaching those most in need first. That's critical, but it's happening at the same time that we're dealing with these multiple complexities. And if we have those community voices front and center through platforms like this, it's keeping us in check as we're managing these global processes, but it's also helping us make those connections that Lisa was talking about, because that connectivity is absolutely critical. It's where the learning is multidimensional. It's not one way, it's not two way. The learning is multidimensional. Also for the COVID response. The COVID response is also learning from Ebola, from HIV, from other areas. And again, we've just got to really, what's been exciting for me is, and Brian touched on this, we're creating this new architecture. We're creating this new way of working across these global health agencies. I think you guys are probably better connected than you've ever been as well in terms of the international NGOs linking more smartly with the community groups. We've got to keep this momentum going, all of us, for all of health. I think it's a fantastic opportunity. So thanks.
Thank you both. And that, I think you guys are also, one of the questions that's come in from Frank Page was about the lessons, the partnership lessons that you guys have been gaining. I think you've been all speaking to that a great deal. I also wanted to highlight a question. Lisa, you brought up a bit about structures in place, when something does go wrong, that there are going to be it won't always go perfectly, and there will be some adverse effects at times. And Bami Soap Adejanu, I apologize for my pronunciation. He brought up a question exactly on that, about whether there's a plan to ensure grievances related to the vaccine are addressed. Do you think did you get a response there? Or do you have any further questions to that? I want to give you a chance to elaborate on your question.
Thank you very much. My question is just what I already put there, because I understand that in as much as all the WHO can really do is to support countries for readiness and delivery, I just want to know whether like the WHO would also require, countries and other partners to, come up with environmental and social management plans, which would include a grievance redress mechanism, so that persons who have complaints or who are affected by, particular vaccines can actually, make their complaints and have it redressed.
Thanks, Bamiso. So it's a really good question, and I don't have a complete answer to this. I know there has been discussion about compensation schemes for certain grievances or events, severe adverse events that would be associated with the vaccines. Again, assuming the causality assessments find that it is vaccine related. And so there have been discussions about setting up these compensation mechanisms, but doing that fairly is extremely complicated, because there's not a lot of equity in people's ability to take up those grievances and to be able to pursue it. So where they have existed already in immunisation programs, they've been implemented in an extremely unequal manner, and really only people from high socioeconomic status backgrounds have really been able to take advantage of them. So of course, I'm generalizing, but I would say that that's still under discussion, and I'm sure there'll be more information available from WHO as that takes shape and is formalized.
Thanks. And we're gonna move very soon to the extended panel. But before we do, one last question that came in. Brian, you mentioned, I think it was you mentioned the funding gap. What concretely, this was asked, what would that mean if that's not filled?
Thanks, Nelly, and thanks for the question. Maybe just before I take that one, on partnerships, some very quick reflections on partnerships with civil society so far. I think if you were talking to some of the civil society organizations that are intimately involved in the various work streams that Lisa was referring to, I've heard a couple of comments from them. The first of all is that at last we've got it right. There is civil society representation in every work stream of relevance across all of the pillars. There's still work to be done on the health systems connector, but I've seen some recent positive moves to increase the civil society representation there. In full transparency, some of the other feedback that we've heard is that there's still a lingering sense among civil society that, the big agencies are somehow paying lip service to their engagement with the whole project, that their voice isn't being listened to in the same way as other agencies, and I think we need to work better on that. The other element, which for me is a challenge, frankly, is the plethora of civil society organizations that have appeared on the scene working in the COVID space. So it's been really difficult for us to know which are the organizations that are really making a difference, that are active and working hard. So the more we have networks like this one, the easier it is for us to work with civil society. And finally, we're also struggling a little bit, which is we're so pleased to have this call. We're struggling to connect with the global south and at the community level. we've got a, you know, tried and trusted network in the global north and getting great support to try and raise that money. But we are struggling a little bit, and we need to do better, I think, engaging with civil society and community organizations in Africa and beyond. On the funding side, we're not contemplating not getting the money, frankly, folks. This is, you know, it's the only global solution. And time again, we hear from political leaders that they support this accelerator as a means to bring an end to the pandemic as quickly as possible. You know, we had a UN General Assembly resolution, session a few weeks ago when all of the world's leaders came in and said, yes, we support. And just when we thought we were finished, Angela Merkel dialed in to say, yes, she also supported. So the challenge for us is to move from having that level of political rhetoric, if you like, although we do firmly believe that the commitment is there, but to move from that to find the funding. So we're looking at ways of bringing in global champions who would help to, you know, to explain the case for investment, but also to reach out to the political leaders. And I think we're also, you know, we're reasonably confident that with the new administration in the US, that there will be an important contribution from the US in that respect. But also we need to provide the space where all of these leaders can come together to actually to fill the gap. Sorry, I was a bit long-winded there.
Not at all, thank you. And I appreciate that that's where all of your headspace is, you know, this will happen. And Karrar, who you will all be hearing from soon, I believe he mentioned that we don't think about vaccine and economic returns, but on that angle, in terms of the economies coming back to life, there will be such a fast return on the investment. With that, this has naturally moved to the next segment, I think, on access and advocacy. So Gunjan, over to you to continue the discussion.
Thank you, Nellie. And I know there are a bunch of questions that we've received around issues of access, issues of trust, issues of partnership, and others. So we will take them up, but we do want to welcome 2 more people to our panel. So we will continue to have the WHO team, but we also now have joining us Karrar. He is the Access to Medicines Advisor at Save the Children UK and leads Save the Children's Pharmaceutical Policy Workstream. Karrar is one of the civil society representatives on the Access and Allocation Working Group of the ACT-A vaccine pillar. So, you know, the civil society representation that Brian was talking about and Lisa was talking about. Karrar is one of the people who was at the table representing our voices. Anna Marriott is Oxfam International's health policy lead, and she leads Oxfam's work on health for all. She has played a key role in the establishment of the People's Vaccine Campaign since May and is the co-lead on policy for the People's Vaccine Alliance. So welcome, Anna and Karrar. We will continue to take questions from the audience and to try and get to some of the questions that have been asked earlier around some of these issues. But you know, something that Brian actually acknowledged a little earlier was this thing about the number of civil society organizations and who gets represented at the table and whose voices are heard. And Karrar, I was wondering that, you know, if you could speak a little bit to that, and if you could speak a little bit to what kind of space is available for local civil society organizations, you know, grassroots organizations like many of our partners on this call who are in the communities to be at the table, to carry their concerns and also carry that right information back to their communities.
Yeah, if you guys can hear me or not, my mic's been very temperamental, but yeah, firstly, just thank you for kind of inviting us and giving us the chance to speak with kind of colleagues and almost kind of expanding our networks and creating those linkages. As for your point on civil society representation, I mean, as was already mentioned, on the inception of ACT-A, the vaccines pillar or the various pillars within ACT-A, so the diagnostics, vaccines, therapeutics, and this health system strengthening connector, just to say that, what's been achieved to date is nothing short of a miracle. That, all these big UN agencies, all these big agencies have been able to get together in such record time to essentially set up a mechanism to prevent us from falling and repeating some of the same mistakes that would have happened in the past. So, the H1N1 or the swine flu pandemic, that was a kind of catastrophe essentially in terms of equity and global access to medicine. So just to say this kind of ACT-A that has been set up so far in the kind of breakneck speed that it has been done is nothing short of a miracle. That said, there has been challenges around civil society getting access to some of the earlier design kind of work that was being done. So I guess as these structures were being set up, civil society basically didn't have much visibility. So we kind of called for or championed for civil society representation within the various pillars. And that call kind of came back in July, I would say, within the kind of, as the, specifically now within the vaccine space, as Gavi, the secretariat that's leading the COVAX facility or the vaccine pillar of ACT-A, as they were kind of getting the structure set up and the design features set up, we've been basically calling for civil society representation within that pillar. And the Gavi secretariat after a while kind of heeded that call, and they put out the nominations for CSO representation. And that has spanned the three components of the vaccine pillar. So you have the design, or you have the kind of research and development pillar, which has been led by CEPI. Now CEPI is this kind of research and development, product development partnership that is looking to build a portfolio of vaccines. Then you have the allocation framework that was spoken about by colleagues from WHO, and that is essentially looking to put together an algorithm for what would be the optimal kind of rules-based approach to getting vaccines to all countries. And then finally, you have the actual delivery arm, so the operations side, which has been led by Gavi. Now, bearing in mind, Gavi had a traditional mandate of vaccinating, children essentially. So the fact that this is a big step up even for them to kind of touch on vaccinating a completely different clientele. And just to say, as Brian had kind of already reiterated, we managed to land civil society participation across these three pillars through various working groups. So then came the challenge of actually, well, who is civil society? When you say civil society, what do we mean? We know there is God knows how many civil society organizations working globally across different therapeutic areas, right? So traditionally, we would have had a range of civil society working from a kind of community engagement piece to quite specific disease or vertical disease programs. And all of a sudden, our workload has become COVID-19, ACT-A, ensuring access. So essentially, this is kind of unprecedented times whereby civil society had kind of come together, and essentially, what visibility do we have of all the different organizations that are out there that have interest, that have appetite, and that have the capacity to work on this? So this is essentially what is being set up as we speak. So the civil society kind of platform is being set up around the kind of ACT-A as a whole, is being led by the Gavi Civil Society Steering Committee, which some colleagues on the call may have access to. There's also the UHC 2030, or the Civil Society Engagement Mechanism, which is also one of the mechanisms that is looking to kind of bringing civil society and especially grassroots communities on board. And as I said, there are platforms that are being set up to try and disseminate information, but then also the goals are there's the kind of twin goals of trying to share the information to basically bring everyone on board at the same time, and everyone to kind of get this sense of co-creation to minimize aspect of distrust, but then also this kind of feedback loop that needs to be set up. So whenever new iterations of these documents or new iteration or design features of these structures come to light, essentially civil society groups have a say and are able to kind of input and feedback. So I can share some of the kind of platforms that have been set up for some of that information dissemination. And just to say, there is a mapping that is being done, essentially to try and figure out when the WHO has been tasked with reaching out to civil society, what does that mean? Who are we referring to? What is the geographic kind of spread of those societies? Where do they reach? So having that visibility, I think, is key for us to then, when these different iterations come out, that we're able to then tap into the various kind of organizations, whether they be grassroots, big INGOs, or otherwise. And just to say that, at the macro level, there is a civil society representation in these structures, but even more imperative is at the ground, because essentially you know, I mean, obviously there's a lot of people from the continent here. Being from the continent myself, you only have to look at the African family WhatsApp groups to look at some of the kind of vaccine hesitancy and the anti-vaxxer rhetoric that's going around. So if that is anything to go by, you know, there are some serious things that need to be kind of put in place to restore that confidence. And the only way that's going to be done is by bringing communities on board, you know, as a kind of co-creation piece and to have full visibility. At a macro level, that means the civil society representation, which we've been able to land. But at a country level, that means these task forces that have been set up at a country level include civil society or include communities at the front and center. And there are best practices that have been developed, you know, from the kind of the HIV response, and that normative best practice has already been established in terms of getting communities at the heart of that response. The same now needs to be replicated to COVID-19, because God knows the implications are that much greater.
Thank you, Karrar. And yeah, thank you for sharing that link. I think all of us want to, you know, would love to know about some of these mechanisms for engagement that are there. I also know that I had heard Lisa and Andy and Brian had told me during a earlier briefing call, that they would in fact love to hear from civil society organizations on this call. What opportunities and avenues do they see of how they can engage with governments and organizations on the on the rollout and the preparation of the plans and this acceptability of the vaccines. So we will come to that very quickly. But before that, before we actually move to a little more detail, Anna, I want to bring you in. And actually, I want to ask you that, you know, just this morning I read that, you know, and we've been hearing for the last 10 days or so now that at least 2 vaccines seem to be very near to being available. And then we've heard in the earlier part of the call about some of the structures for equitable access. Brian talked to, you know, the vaccine nationalism that we've been talking about. So tell us a little bit, you know, what is this access landscape for the vaccine looking like? What are some of the concerns that you've been hearing, you know, at least from civil society organizations and on the ground about equitable access between countries, but also within countries?
Thank you, Gunjan, and it's wonderful to be here. Thank you for inviting me in. Can you hear me well? Great. Yes. Yeah, I mean, it's been amazing, hasn't it? The last week or so, we've heard these amazing scientific breakthroughs, incredible. The word unprecedented is being used a lot in the last 10 months, but I think we can say that about the speed of progress that that has been achieved. But I think the Pfizer and the Moderna vaccine illustrate very well, unfortunately, the huge access challenges that the world faces right now. We know that both companies are predicting to be able to produce around 1 billion doses of their vaccines by the end of 2021. We know what the global population is. You can see just from that there is a severe supply issue. And on top of that, with this finite supply, we do have what is being called vaccine nationalism, and you know, looking at the figures, we know that for both vaccines, around 80% of that 1 billion supply has already been purchased in advance by just a handful of rich countries. So we have a very big problem on our hands, and I guess our work at Oxfam, but also as the People's Vaccine Campaign, has really tried to strike at the heart of that problem, that supply problem, and how do we unlock greater supply to be able to reach more countries, more people, so that we can actually, pursue the allocation framework that the WHO is working so hard on. And one of the huge supply constraints that we're targeting in our work is intellectual property, the monopoly kind of control of pharmaceutical companies over the vaccines, that they get to decide how much gets made, what price is charged for those vaccines, despite millions, sometimes billions of public money that's been invested into these companies and into the research and development that has led to these successes. But also, what are those companies doing to transfer their technology and know-how to a wider range of manufacturers around the world who may be able to produce those if they have access to the data, to the science, and to that know-how. And I heard the CEO of Moderna, of the Moderna vaccine, on the radio yesterday saying that in theory, there are no constraints to greater wide-scale production of their vaccine beyond the 1 billion that they say they're going to produce. He said himself it was the technology and the know-how that are the barriers. So the obvious solution, therefore, is that pharmaceutical companies need to actually share that technology and know-how. And the WHO, along with governments like Costa Rica, have actually launched a facility to help achieve that. It's called the COVID Technology Access Pool, or CTAP, which is asking companies to voluntarily put their science, their know-how, their research, and remove the intellectual property barriers, remove the exclusive licenses, remove the monopoly control of pharmaceutical companies, and share the fruits of their work with the world, so that we can scale up that access. Now, those two initial companies very starkly illustrate the supply problems, and we need more than 1 billion vaccine doses, particularly given that most of these vaccines are going to require 2 doses. So we're talking about 500 million people being able to benefit, for example, from the Moderna vaccine. But the same supply issues exist for many of the other vaccines as well. And this monopoly control by pharmaceutical companies has led to the development of the People's Vaccine Campaign, a campaign that initiated in May with a very high-level letter signed by current and former leaders of countries around the world, calling for a different approach this time, drawing on the learnings from previous pandemics and epidemics, the HIV treatment, inequity in access to HIV treatment really at its core, and the lessons learnt from that if we just rely on the voluntary actions of pharmaceutical companies, we will continue to see inequality in access, high-priced medicines, and lack of access for those located particularly in the global south. So that People's Vaccine letter that was signed, as I say, by over 100 current and former leaders and influential economists and people around the world in May, has actually led to the development of a much broader civil society alliance. We're calling the People's Vaccine Alliance, has developed into a much broader campaign, focusing on both governments but also pharmaceutical companies to really break with the old model. In the context of this crisis, we need to find new ways of scaling up access, bringing down prices, and making sure that there is sufficient supply for the world. And the current model isn't cutting it, unfortunately.
Thank you, Anna. So we have a lot of questions coming in and tackling a lot of issues which are extremely important. So in the interest of time, and because we want to get to as many as possible, what I'm going to do is that I am going to combine a few questions together. So I'm going to take a few questions together, and then whoever in the panel, can address pieces of it. And while we do that, I also want to ask our civil society representatives on this call to think about the question that WHO team had initially asked us, and that one of the questions we flagged, which is that what are some very concrete ways in which we think we can support them and governments in this entire piece around acceptability and access? What are some, if you can share some of the initiatives that you are doing, or you can share ideas. We will, after we take one round of questions to the panel, come to you for that. We probably won't be able to hear from more than 2 or 3 people on this call, but please keep your responses to a minute and a half. And then the rest we can maybe compile and figure out a way of sharing those, Lisa, Brian, Andy with the team to share a broader perspective. So the questions first. So there was this question around, since we've been talking about access, there was one question around the fact that we've heard from a number of, we've heard that one of the first groups of people who are going to be getting access or getting the vaccine is going to be the frontline workers or the health workers. And in many countries, not all the health workers are registered, that they are missed out of the system. So what kind of systems are in place to ensure that all health workers are going to be covered? Similarly, there was a question around gender dimension of access. Like, how is that being tackled in this entire vaccine rollout plans? The third question that I want to flag is around this issue of funding. That we've seen since COVID has hit, that grassroots community-based organizations have really been working with community leaders and have been the first responders, but they don't really have funding. Are there any mechanisms in place to help and assist them? And I know, Andy, you had mentioned that the WHO may be coming up with a funding window to aid that. So maybe you could speak a little to that. So I want to throw those 3 questions to the panel. And what I'm going to do is I'm going to ask who wants to go first, but you can address any or all of them. So who wants to go first? I see Andy raising his hand.
Thanks. Thanks so much. And thanks again for a really rich discussion. And I've been looking at the chat as well. Fantastic comments coming through there. I do think that, first of all, let me address specifically the question. We have this Solidarity Fund, which is being managed through WHO. And I know that a number of focus countries have been identified where we're really keen to see enhanced community and civil society engagement in those countries. And so we're currently really finalizing, what a funding access modality might look like for that funding that's going to be made available for the first 6 months of 2021. And I understand we should have some information online quite soon. I think some early conversations have started with a number of countries and possibly with a number of civil society groups. If there's anybody on this call who's been part of those discussions, I hope you please raise your hand or drop a note into the chat. We weren't able to get our colleague who's working on that to join us today, but we can certainly share information through Gunjan and John to the network once the details are finalized. It will be a fairly rapid turnaround, I think, to get some applications through. I think a lot of it will be around COVID decision making. So it's perhaps looking at some of the strengthening the inclusivity of some of those structures that are being set up. And we know from some of the analysis we've done as well that we're often noticing, certain groups are left out. There's poor gender diversity within some of these decision-making bodies, etc. So we're trying to keep an eye on that and make sure that the marginalized voices that are so important are certainly coming through. And then just one other point before I turn to other colleagues. I think the point about making sure that we've got inclusive definitions about who are health workers and who are frontline workers is critical, because we need to make sure that the community health workers and people who are working in community-based organizations to get health services out to the most in need and often perhaps more difficult to reach through traditional service mechanisms are really part of that whole process. And I know that a number of organizations, including Global Fund and UNAIDS, are looking specifically at clearer definitions that would allow for that to take place, that could potentially feed into some of that decision making around priority uptake of vaccine once it's available. Thank you.
Thank you. Does anyone else want to answer the questions around access for health workers or around gender access?
Gunjan, yeah, I could briefly take the question about health worker access. So as Brian outlined, WHO and our strategic advisory group of experts on immunization, in consultation with a wide range of experts, ethicists, lawyers, social scientists, many others, have defined the prioritization framework and a roadmap for rollout and prioritization of these vaccines. And that's where, as Brian noted, health workers have been identified as one of the first main groups to receive these vaccines. At the same time, we know that that's a WHO recommendation, and at the end of the day, ultimately, countries and economies are sovereign and can follow a process as serves their interest in various ways. I think the important thing is to be putting in place accountability mechanisms around that as and where possible, and that can be done in many ways and in ways that makes it transparent as well. So I think that's also where there's an absolutely key role here for civil society and other organizations to be taking a close look at that and just playing a role in drawing attention to necessary ways in which these vaccines are rolled out that may not be equal or fair in certain countries. So I think that it's something that we need to watch closely, and we can continue the conversation on this as well. Thank you.
Thank you, Lisa. Okay, unless any of the other panelists wants to come in, I want to actually now invite some of our civil society members to share their perspectives on some of the concerns that they have around CSO engagement in the processes, around the vaccine country plans, or ideas around engagement. So, okay, do you want to raise your hands? I'm going to monitor raised hands to see if anybody wants to speak to it. I see Roland's. Roland's, would you like to speak to this?
Yes, a quick comment that I have is that I would like us to draw from the lessons when the pandemic hit. Why do I say that? It's because the extent to which one trusts the message really depends on the extent to which one trusts the messenger that this messenger represents my interests. Now, grassroots CSOs, as well as the community leadership, did not withdraw when the pandemic hit. When most of the INGOs, we were busy withdrawing our experts from the ground. And at the time when we wanted to come back, some INGOs actually had to strategize on re-entry processes because there was an issue of trust there. Now, I think the biggest mistake we are going to make at this stage is not to trust the very leadership that stood with the people when the pandemic hit and they had nowhere to run to. They stood with their leadership with that particular community. If we miss that recognition, I think we are going to make one of the biggest mistakes in our history. And my hope is when we are struggling with the definition of civil society or community or leadership, we are going to be conscious and be educated enough to acknowledge the community leadership. And that's what the role most of us can play, because we work, our main role is to really mobilize community leadership, self-reliance, and sustainability. And we can play that role in this particular process. Thank you.
Thank you, Roland. I see Deanna has raised her hand. So Deanna, and then Sia next. Thank you.
Yeah, thank you. I think it's related to what Roland's brilliantly said. And this is something about engagement, because in this case, we know there are a lot of plans from national governments that they decided how to get engaged into the whole vaccine process and how are they going to distribute it. And that's happening, for example, in the case of Mexico, but there's no clear, there's not a clear space for communities participating into that process. I know sometimes this is a national security issue and everything, but this is something that is going to be addressed particularly to people, and people needs to be part of that, especially because we're speaking, and I recall something that Annette already wrote in the chat about what happens when those communities are not having a second, not even a first wave of COVID. There's no COVID in there yet, and they don't have all the information, and how make sure that this is going to take into account the particularities of rural communities or indigenous communities, and they don't have enough access to information, and there are a lot of issues in there. And I don't know, of course, this is something addressed to national governments, but at the same time, having this idea and this WHO perspective, what could be the recommendations or the actions that we all can address for engaging governments to really deliver the vaccine to everyone and not leave no one behind.
Thanks, Diana. Sia, I know you raised a point about women CSOs, so if you want to quickly make that, thank you.
Thank you, Gunjan. Yeah, just wanted to say that in our experience with our CSO partners, which are primarily women's collectives in rural Maharashtra, India, what we found is they've really stepped in and filled the gap that government is not able to do. So where the government systems are understrained, these women's collectives, such as self-help groups, other collectives at the village level, have played a crucial role in spreading, sharing COVID information, dealing with misinformation, distributing everything from emergency ration supplies to facilitating COVID testing. So I would just say, keeping that in mind, those are the groups who should be involved in the decision-making process, in the planning process for vaccine distribution, rather than then calling them in when the government has failed and when the national systems are failed. Thank you.
Thank you so much, Sia. So I know Dr. Rebecca wants to share. I know Nicole has raised her hand. So we have a lot of responses. So here's what I want to propose in the interest of time. We also have a whole bunch of unanswered questions and some really good questions around infrastructure, around some things we are hearing around vaccine treatment, around trust and relationships, and using those to address issues of misinformation. So there's this whole plethora of questions. So if the panel agrees, what I want to suggest is that we will consolidate these questions for you. And if you can, maybe give us consolidated responses, then when we share the recording of these calls and when we put it up, we will share the responses so that we make sure that the questions are all addressed. So I don't know, would that be acceptable to panelists? Are you willing to take on that additional task of answering these extra questions?
For me, that's fine, as long as they're consolidated. And as you suggested, I think that's perfectly fine. So we can do that in the next few days. And it's great to see the interest. And I do think this is the start of a conversation too. So we might not be able to answer everything right now in the next few days, but I think we can come back, as and where needed to continue this conversation.
Perfect. Thank you, Lisa. Karrar and Anna, would that be fine with both of you as well?
Yep,
okay, great. So for those of you, for Dr. Rebecca, Nicole, and others on the call who wanted to share but did not get the chance to share, we will also communicate, we will take your inputs and make sure that those are also a part of what we send out, the package that we send out. So it will be consolidated questions, suggestions, comments that go to the WHO team and to the other panelists from the People's Vaccine Campaign and to Karrar from SAFE, so that we can answer them. As the moderator, I also want to take this opportunity to actually use some of to actually offer the network, the MCLD network, as a platform where we can at least try and consolidate this flow of information in the two directions to make sure that community voices can be carried to you, the organizations, the grassroots organizations and their voices can be carried to you. We work not just at a global level, but actually most of our work happens at the national level through our national chapters, which are, and a lot of people you see on the call are these national chapters. So we do want to offer that opportunity and that platform and to be engaged if that is possible, feasible. And we can continue the discussions around that later on. But we do need to move to the next steps because we are almost at the end of time for today. So Nelly, over to you.
Thank you. And thank you to the panelists, but also to all the participants in the call who had these really remarkable comments and questions. And I appreciated, as Lisa said, this is the beginning of a conversation, and that this group is such an important resource, I think, for the efforts that you are all trying to do. As Roland said, they've been there throughout and thinking about how to communicate and how to get supplies to communities, even in the midst of lockdowns and things like that. So as Gunjan mentioned at the very beginning, we see this as the beginning of a series, sort of a mini series within our larger series that's focusing on vaccines. We will return to this topic in our next call, which will be on December 9th, before the holiday season begins or people take winter leave. And that call we'll take some of these discussions and bring them down to the national and community level and really apply them to the work that all of you do every day in communities. We will return to having breakout groups, and we will use those as an opportunity to discuss and strategize amongst each other how we can effectively advocate for communities' safe and equitable access to vaccines, and also effectively communicate the right information to all sorts of partners. As we said, we imagine this will be a big part of people's work and life coming up. On that call, we will also hear from some more partners, both at the global level, including from the African Union CDC and organizations that are working on country level implementation, including Save the Children, as well as representatives from the Community Health Workers Impact Coalition, and from our own movement chapter in Mexico, where they've been exploring and discussing issues of vaccine access and rollout with other NGOs. Karrar also mentioned the mapping of CSOs. If there's any way that this group can directly contribute or feed into that or anything, please let us know and we'll share it more widely. I know also Annette and Deanna were asking about resources in Spanish and French, so maybe we can check in with the panelists about that afterwards. I also wanted to, just before we close, take a moment to congratulate the Amos Youth Center. We heard from the Zambia chapter. We heard from them from the Zambia chapter of the movement on our last call, and they have been chosen from amongst some 400 organizations for the Civil Society versus COVID-19 initiative by the African Development Bank. So many congratulations on that. That's really amazing. Also, the next global community-led development call, not the COVID call specifically, will be next Wednesday on November 25th. And that will include a chance to hear about 2 new tools that have come out of the movement, one of which is the CLD self-assessment tool. And another one is, and it will be available in many languages, sorry. And another one is from the Catholic Relief Services, who will be sharing about their mini social cohesion barometer. So that will be very exciting. And we'll be hearing from the research team that put together the self-assessment tool as well. And then finally, there will be a special share and learn event on November 24th at 8 a.m. Eastern Time, looking at how community-led development and food security are synergizing. And on that, we'll hear from Rwanda's Garden for Health, Nauru's Nigeria program, Uganda's Food Rights Initiative. That's a lot of announcements, a lot of things coming up before the end of the year. And there will be emails that go out to all of you. But most importantly, thank you to everyone. And we look forward to continuing this conversation and seeing how we can support the access, the safe and equitable access of the vaccine.
Thanks, Ali.
Thanks.
John, can we actually have the last slide, please? There is one more slide in that presentation that we want to put up before we go out. And I just want to say a big thank you to everyone here, to our panelists, for people who've asked in language resources. We could not do this call we could not have interpretation for this call, but we recognize that a lot of our partners are only French or Spanish speaking. So at least the key takeaways document and some of the key questions we will try and make available in multiple languages on the MCLD website and for distribution for different organizations and people who only speak in those languages. As promised, we will take your questions and we will also look out for that email from us with all the resources, the recordings, and the answers to your questions. Thank you everyone for your time here. I also wanted to step in because I want to recognize the team that puts together this call. So Nelly and I may be the faces of it in terms of facilitation, but we get a lot of support from all our teammates. So John, Anne, Sarah, Izzy, Chris, Alex, everybody who is not spoken up but is instrumental in doing these calls, and all of you. The calls are all about what you bring here, your energy, your ideas, and your time. So thank you so much. As always, we will leave the call link on for a few minutes if people want to say bye or hang around for some last minute comments, but we recognize everybody has things to do, so feel free to drop off. Thank you very much.
Thanks, everyone.
Thank you very much. Thank you, everyone.
Thank you. Bye-bye.
Goodbye.
Thanks a lot. Bye-bye.
Thank you.
Thank you. Bye.
Adios.
Bye. A bientôt.
A bientôt.
Thank you. Thank you, everyone.
Thank you. It was great. Gunjan, you are a master. That was so good. You just keep these meetings moving. It was so good. And to all the panelists, were so amazing. Yeah, that was great.
Yes, I have a good news. I
gotta
got
head
a
off.
new
Bye.
grandson just now.
Congratulations, Dr. Rebecca.
Nelly, I know you have to drop off.
The fifth one.
Oh, that's wonderful news. Congratulations.
What's the baby's name? Do you know yet?
No, not yet.
That's so exciting. I saw the picture on WhatsApp. It's so